In functional medicine, we always remove triggers first as a foundation before adding anything. Clean the environment of mold toxins to ensure pure air and remove inflammatory foods and allergens from the diet. Replace harmful chemical products with non-toxic and safe personal care and cleaning products to lower the total body load of toxins. After starting the anti-inflammatory diet for a few days, then start clearing any gut pathogens. Remember that the limbic system will send a signal to the adrenals to release stress chemistry for anything perceived as a bodily threat. We want to stress the importance of limbic retraining in restoring health due to mold exposure. With the chronic breathing of mold toxins, the body becomes highly inflamed and will cause a PTSD-like stress response. Retraining the limbic system to properly release stress chemistry is necessary to rebalance the immune response. This is the place to start for many individuals that are unable to tolerate many foods or supplements. We have seen dramatic improvements in the ability to tolerate more foods and supplements in a very short period of time with daily limbic retraining exercises and vagal motor outflow stimulation. Next, we will want to start repairing the epithelial and mucous lining of the small intestines. This is also the time to fix any anemias discovered from blood work and to improve tissue perfusion and blood glucose dysregulation. Restoration starts by removing the triggers, by being in a mold-free environment, and changing the diet that will help to reduce inflammasome activation. We will discuss this in more detail in this presentation on how to reduce inflammasome activity. Most clients will end up with a Th2 dominance. This needs to be addressed first before offering anti-inflammatory supplements which inhibit Th1 and further exacerbate the Th2 imbalance. Things like perilla oil, quercetin, nettles, selenium, fish oil, or immunothrive may be appropriate to start with. Next, support Th1 and the innate immune system, and block Th17 if there is an autoimmune process ongoing with things like curcumin, resveratrol, and vitamin A. Replacing nutrient deficiencies aids the restoration process. Testing can help determine which steps to take. Because we can't assume everyone with a mold illness has a Th2-Th17 polarization. The first 3 modules of the Mold Detox Diet course were created as an introduction for the layperson on how to get started. Also for the practitioners to recommend for their clients so that their time in this beginning phase is freed up from repetitive education that all patients need to have when starting to recover from mold illness. The focus is on lowering the toxic load by cleaning up toxic products and inflammatory foods. The best anti-inflammatory diet to follow is the autoimmune paleo diet. However, some individuals may have SIBO or SIFO or an inflammatory bowel disease that may need a more specialized diet plan, like the low FODMAP or the specific carbohydrate diet. As a result of chronic inhalation of mold toxins, the limbic system is on high alert and histamine is triggered easier. Low histamine diets can be helpful along with limbic retraining. The ketogenic diet is very low in protein and may increase LPS absorption from a dysbiotic gut. It isn't tolerated well with many individuals with mold illness, as many of them are dealing with imbalanced gut flora and food sensitivities. Please see molddetoxdiet.com for a full diet program. If you are a practitioner, you can easily utilize this for your clients through an affiliate link. Our cell membranes are 2 cell layers thick. The outside has a polar head, and the inside between the 2 polar parts is the lipid layer. These lipids make up all cell membranes. They are important because they regulate the cellular osmolarity, fluid balance. They regulate nutrients coming in and waste products going out. In the lung, they have a big job of regulating the oxygen exchange. When the macrophages eat a pathogen, it creates a lot of reactive oxygen species that can damage these lipid bilayer membranes. This is the place where most of the body's vitamin E is stored, so it can act as an antioxidant and protect those lipids from free radical damage. Cell membrane damage is involved in practically every disease process. We can't stress how important it is to pay attention to the cell membrane health of an individual. This is always a good place to start in any complex disease. 50 to 80% of cell membrane phospholipids are made up of phosphatidylcholine. It also contains phosphatidylethanolamine, phosphatidylserine, and other lipids, proteins, and carbohydrates.